So now we had seen about CML. Let's proceed on to Polycythemia vera, which is the next myeloproliferative neoplasm. So Polycythemia vera, here it is going to be the erythroid related, but as such there is going to be pan-myelosis in these patients, not just erythroid precursors, myeloid precursors, megakaryocytic precursors. All three is going to be proliferating. So all three are myeloid lineage, right? So pan-myelosis is going to be present in PCV. So P for P. Okay. Apart from that, the diagnostic criteria involves hemoglobin levels. So hemoglobin, if you test and it is more than 16.5 in a male and more than 16 gram percentage in a female, or if you check for the hematocrit, that is a PCV, if it is more than 49% in a male and 48% in a female, again it is going, we have to think about PCV. But the another important thing here is the serum erythropoietin levels is going to be subnormal, diminished. Okay, so normally erythropoietin is as the name suggests, is going to cause erythropoiesis. So it is going to stimulate erythropoiesis. But in this Polycythemia vera, this is going to have a subnormal erythropoietin level. This is a characteristic finding again. And for genetic level testing, if you see, we are going to have JAK2V617F mutation and JAK2 exon 12 mutation. So these two are going to be seen in Polycythemia vera. So as such, when this hemoglobin and hematocrit values, RBCs, are going to be elevated, it is going to cause a increased viscosity in the blood. So whenever there is viscosity, there is going to be stasis. So stasis can result in the formation of multiple thrombi. So you can have a history of DVT, Budd-Chiari syndrome, hepatic vein thrombosis, or stroke. So history of this multiple thrombus will be there. So Budd-Chiari syndrome, I already mentioned, it is not that common. So whenever the patient is presenting with Budd-Chiari syndrome, when the hepatic causes are ruled out, you will have to think about the three causes mainly. One is the Polycythemia vera, another one is the PNH, which is paroxysmal nocturnal hemoglobinuria, and the third one will be APLA syndrome, antiphospholipid antibody syndrome. Okay, so Budd-Chiari for PCV, PNH and APLA. Okay. So the classical finding in Polycythemia vera will be intense pruritus after a hot water bath. So this is because there is going to be release of histamine from the basophils. There is pan-myelosis, right? So basophils will also be increased here, and these basophils are going to be producing the histamine. That is going to cause the pruritus and the flushing associated with it. Then the patient will also complain of headache and hypertension because of the increased viscosity. Then peptic ulcer disease, again because of the histamine release from basophils. Then gout. So there is going to be pan-myelosis, right? Lots of proliferation is going to happen. So that is going to result in hyperuricemia. Increased turnover of the cells is there. So hyperuricemia is going to result, and that is why gout is going to be there. So bleeding because platelet is going to have a dysfunction. So these are the classical findings which we see in Polycythemia vera. So what are the differential diagnoses for Polycythemia vera here? So secondary Polycythemia vera secondary polycythemia and ectopic erythropoietin production. So secondary polycythemia here, as such, if you see, there is going to be a hemoglobin and RBC elevation again, but the most important thing here is the erythropoietin levels are elevated here, and the oxygen saturation is going to be decreased. So in respiratory failure, you can have this kind of a picture. So here the oxygen saturation is going to be decreased and erythropoietin levels are going to be elevated. Okay, so this is the difference. And an ectopic erythropoietin production, like in paraneoplastic syndromes, right? So there, and like in RCC and HCC, ectopic EPO was produced as a paraneoplastic syndrome. So in ectopic erythropoietin production, here again the RBCs and hemoglobin will be elevated, but the erythropoietin level again here will be elevated, but the oxygen saturation will be normal. So in PCV also the oxygen saturation is going to be normal only. Okay. So this is how we differentiate. In PCV, the erythropoietin levels were decreased.